Distinguished guests, good afternoon and welcome to the session today, Ending the AIDS Epidemic in Light of the Shrinking Civic Space. The German Federal Ministry of Health is a long-standing partner of the World Health Summit and a strong supporter of this forum. We are particularly glad to promote this collaboration and foster this open dialogue. The aim of today's session is to highlight the critical role of civil society in ending the AIDS epidemic by 2030 and to identify challenges and successes in addressing the shrinking space for civil society globally. The session will focus on the implications of this shrinking civic space for community-led HIV response, and we'll hear from our panelists of their experiences at national and at regional level, as well as one of the role of the governments and international institutions with a particular focus on UNAIDS and its co-sponsors in securing civic space and empowering civil society. As a strong advocate for global health, the German government has developed, as most of you probably know, a national global health strategy, which was launched back in October 2020. It focuses on multilateral action, political leadership, innovative approaches, and cooperation at all levels to address the current global health challenges that we face, including HIV and AIDS. One of the strategy's key priorities is to further strengthen the global health architecture, for example, by supporting UNAIDS in its key role in leading and coordinating measures to end AIDS. UNAIDS has indeed a unique organizational character in the UN system. The Secretariat coordinates the HIV-related activities of the 11 co-sponsor organizations and supports member states in implementing their national HIV strategies and programs. UNAIDS is the only UN agency with civil society representation on its board, and I think that is really, really important, and we are glad to see that. Germany has this year the program coordinating board chair, and in this position, together with UNAIDS, Germany will continue to work towards the fulfillment of the UNAIDS mandate that is critically important to the German government. Just like UNAIDS, Germany places civil society involvement at the core of its national HIV AIDS response, including also the provision of funds, and it advocates for the protection of the meaningful involvement of civil society on a national and on an international level. So I'm therefore very glad to see that a representative of a German civil society will also be present today on the panel, and would like to highlight and thank civil society organizations for their continuous commitment in the fight against HIV and AIDS and for the communities they do serve. I don't want to lose too much time, and I would now like to introduce the moderator of today's session, Clemens Groß. Clemens is the founder and director of Insights for Development, which is a Berlin-based consulting practice in international development and global health. As a renowned expert in the field of global health, he has the task, and I hope the pleasure today, to guide us through this important session. I wish all of us a very fruitful and exciting exchange. Thank you very much. Over to you.
Thank you very much, Paul. Thank you. And a big thanks indeed to Germany's Federal Ministry of Health for organizing and hosting this really important session today on ending the AIDS epidemic in light of the shrinking civic space. Before I introduce our panelists, I'll keep the suspense for just a minute and allow me a few words to situate this topic in today's context. Just to make sure that we in the room and those following online are on the same page. Why discuss ending the AIDS epidemic? That's the obvious one. So tremendous progress has been made already over the last decades in the fight against HIV, but obviously it isn't over yet. Still in 2022, AIDS claimed alive every day. So there's still lots to be done. And what's with the civic space? And is it shrinking? By civic space, of course, we mean the environment in which civil society operates, which is shaped by legal, policy, administrative, economic, social, and cultural factors. An open and inclusive civic space is one that allows and enables the fundamental freedoms of assembly, association, and expression. And it enables meaningful civil society engagement, which has been and still is so crucial in a successful response to end AIDS and to promote health and well-being for all. However, many of us will have taken note of several recent, quite striking signs that this civic space is indeed shrinking. So just let me give you a few examples. In Uganda, a new anti-homosexuality law was just signed into law in May this year, and it provides severe punishments against LGBTQI+ people and organizations. In Indonesia, a new criminal code contains articles that violate the rights of women and people from sexual minorities. And in the US, anti-transgender legislation was introduced in several states, albeit with challenges from some. So taken together, this raises two very important questions. First, how does this shrinking civic space impact the HIV response, much of which is led by civil society organizations? And second, of course, what can be done about it? What must be the role of governments and of international organizations such as UNAIDS to strengthen, to promote, to defend civic space, and to enable civil society organizations to continue their role in the HIV response? So without further ado, let me introduce our four panelists that are here to ponder these important questions with us here this afternoon. And I will start in the middle with Maximina Gioconia. She's the Interim Executive Director of Y+ Global, the global network of young people living with HIV based in South Africa. Welcome, Maximina. She's an experienced HIV and human rights advocate. She's a leader in health programming with a focus on young people in all their diversity. She has also managed the Her Voice Fund, currently coordinating 125 community-based organizations that are serving or leading adolescent girls and young women across 13 African countries. Great you could join us, Maximina. Welcome. I'd also like to welcome Christine Stegling. She is a UN Assistant Secretary General and the UNAIDS Deputy Executive Director of Policy, Advocacy, and Knowledge Branch. Before joining UNAIDS in January 2023, Christine was the Executive Director of Frontline AIDS, and before that, she was the Executive Director of both the International Treatment Preparedness Coalition and the Botswana Network on Ethics, Law, and HIV/AIDS. Welcome. On the far end, but very much in the center, is Andriy Klepikov. He's the founding and executive director of the Alliance for Public Health, which is one of the largest HIV and TB-focused NGOs in Ukraine and in the region, covering over 20 countries in Eastern and Central Europe and Central Asia. Andriy manages one of the largest harm reduction programs globally in partnership with field-level NGOs, annually reaching over 200,000 people who inject drugs with essential services. Among other roles, he is also a member of the Global Fund Audit and Finance Committee, Frontline AIDS Partnership Council member, and a chair of the Oversight Advisory Committee of the TB Europe Coalition. Welcome, Andriy.
Thank you.
And to my right, I'd like to welcome Peter Wiesner. He is, very importantly, a long-term community and LGBTQI activist, having engaged in this space for the better part of 30 years now. He's also, though, an advocacy and public relations officer at Action Against AIDS Germany, a nationwide network of about 300 groups and organizations. In this capacity, Peter follows the UNAIDS Program Coordinating Board and the Global Fund Board meetings. During last year's Germany G7 presidency, Peter served as the co-chair of the Civil Society 7, or C7, Global Health Working Group, developing recommendations for the G7 summit. Welcome, Peter. So with this, let's jump into the discussion. And let's first look at why civic space is so important for the HIV response, which obviously points to the role of civil society. And I'd like to start with you, Peter. As I said, you've been active as an advocate in and for civil society for the last 3 decades. What role has civil society played historically in the fight against HIV/AIDS, and why is civil society engagement so crucial for ending the AIDS epidemic? And when you look back, do you see the legal environment for civil society having changed over time, especially regarding key populations? And has that influenced the community-led HIV response globally? Peter.
Yes, thank you. First of all, thanks for inviting me here, and thanks for the great topic to discuss here. As you said, I'm working in the HIV field as an activist sort of person for 30 years, and the role of the civil society, I think, first of all, civil society was always in the forefront of the HIV response. It was not the industry, it was neither the governments. It were people dying that took the task over to change the situation. Let us remind to the situation in the US with Mr. President Reagan, who avoided to use the word AIDS for about 3 years. And community sort of reminded him about that and pushed him to take that job on. Let us remind the government in South Africa and their sort of ignorance of the true fact and the transmissions of HIV. So they believed into the myth of the denialists that would sell them pills in order to treat HIV. Let's remember the Minister of Health back then. She was sort of mocked as Madame Garlic at the international conference because she thought that garlic would help, and all of this was addressed and was challenged by civil society. Let's remind that it was not politicians, it was civil society that changed and scandalized the situation. When we scandalized, or when the community scandalized the situation, of course we talked about unjust patent rights. We talked about monopolies on ARVs. When ARVs became available, it took about 8-9 years until people in the global south could have access to the ARVs, where people in the global north would, of course, survive and others would die. The industry needed to be forced to lower the price. It was not their brilliance and their, what is the English word for Freundlichkeit, friendliness to lower the price. It was power, and the power came from communities. You remind the sentence, silence is dead. So we have to speak out, we have to change the situation. All of that was done by civil society. We created structures, civil society created structures that would lead to, from bottom up, to organizations like UNAIDS, like the Global Fund, like UNAIDS, like the patent pool. And let's remind that these were sort of bottom-up approaches and not top-down approaches. What we see now is the Pandemic Fund, top-down, bottom-up. There's a huge difference there. Civil society created principles, and for me as a patient, I think it's very important to be aware of the power imbalance that is there between a patient and a doctor, between civil society and governments, and language matters. And by saying this, that I remind the probably most important document that has ever been created, and it's the Genfer Principles. And I just read here. We condemn attempts to label us as victims, a term which would imply defeat, and we are only occasionally patients, a term which implies passivity, helplessness, and dependence on the care of others. We are people living with HIV and AIDS. And with this strong statement, with this self-awareness, this very strong self-awareness, civil society was able to change the situation. All of that led to other principles, like the CHIPA principles, greater involvement of people living with HIV and AIDS, then we have the claim nothing about us without us. That does not exactly come from the HIV movement, but that was taken on, and this was in the spirit of these claims that we, and these principles, these core principles that we developed. And now we talk about leave no one behind. Nobody really sort of is aware that those claims have a long history, that were created by, or at least influenced by the HIV movement. So when you ask me why is the civil society engagement paramount of ending HIV? I think it's pretty straightforward, because there's a discriminative environment, there are attitudes that are out there that would make the life of people living with HIV really dangerous, and that would hinder us to go to the doctor or whatever. AIDS has always been combined in the minds of people with a dirty lifestyle. We talk about, and this relates, of course, now to Western Europe, relates to a dirty lifestyle, gay sex, and all of that. In order to address other people with messages to prevent HIV transmissions, it was necessary to address the cause of the transmission. So all of a sudden, there were discussions on anal intercourse, on oral sex, and all of that. And this was really important to address that and to name it. And luckily, our government understood that those officials don't have the language, they don't have the knowledge, they don't know how the communities live. So they invited and provided this open space for the communities to develop programs and to finance that. And this is a huge difference to what we see in other parts of the country, in Hungary, in Poland, in Russia, where civil society is an enemy. In Germany, civil society was invited to create their own space.
So is the space here also shrinking? And what's the implication of that for civil society, which, as you just mentioned, has worked decades to expand that space?
Yes, it's as well shrinking. And I look now to my colleague Jan Thilo, who is sitting over there, because he reminded me on that. And we just come from the UN high-level meeting on HIV, not on HIV, on tuberculosis, on UHC, and we experienced, we did fight to get a German representation at those high-level meetings, which we had in the past, and this would offer a space to civil society to speak out, to address issues that are in the core of what we need. And unluckily, we see a government that is not interested to invite us, that was not interested in putting a delegation together. We did write them, we sort of addressed this twice or three times, but nothing happened, and this is a mischance. I don't say that this is done by purpose, but maybe it's done by just not really sort of understanding how civil society works and what they need. So for us, it was a lost chance, so we could not really participate. We were there, we had side discussions on the floor, but we could not participate in the meeting. So this is one little example where I think that civil society space is shrinking. And then, of course, we have a fascist movement as well in a country that limits the space. Like in many other countries, there is this sort of rollback where community is threatened. We just walked yesterday. There's a museum around the corner for gay and lesbian communities, LGBTI community, and they were threatened a couple of times with bullets and with guns and all of that. This creates a climate that makes it quite difficult for civil society to sort of speak out and together and to unite and to develop programs.
And thank you, Peter. And Christine, you're obviously with UNAIDS monitoring the situation from, I'm sure, sort of the bird's eye perspective, so cross contexts. What's your perspective on how the civic space has evolved? Do examples or patterns come to mind from countries or regions where civic space has indeed shrunk, but also maybe not to get too dark? Do you see examples of the contrary, so where civic space has perhaps expanded, or where conditions for civil society to engage in the HIV response have improved?
I'm just going to do something that I just learned from my colleague from the US government, Mamadi, and not entirely answer your question, but start somewhere else and then get to your
That's
question.
a great start.
I think let me just add to a few things to what Peter has just said. I think, let's remind ourselves about, what the role is. So Peter has talked about the role of communities being about demand creation. I think we often forget that, even in our conversations with the private sector. We are creating demand for new medicines, for innovations, for diagnostics, and so forth. And the good private sector does recognize that and sees the power in communities. And as Peter says, these drugs and these medicines didn't come to people just like that. They were demanded. So that's a really important role for communities. Often service providers come from communities, and I hope Andre will talk a little bit about, for example, in Ukraine, we have a long relationship with each other where the initial delivery of the ARV program, because of the situation that the government was in at the time, was really done by civil society, by the Alliance for Public Health, and then handed over to government. So a really good example of what you can do to provide services for people when it's necessary, but also step out of it, but maybe then add to government services for communities that might not be reached through public health services. So that's number 2. And then number 3, for me, really importantly, and we spoke about it in the panel a little bit earlier on, is around monitoring and holding people accountable, and all of us accountable. I'm now in a position where I need to be held accountable. Am I doing the right thing? Am I creating spaces? Am I allowing divergent voices? But importantly, member states, governments, and donors. So that's an important role that many of the people that are in this room, I can see a lot of people from civil society in the room, play. So let's remind ourselves of that. And one of the reasons why, and thank you, Paul, for also mentioning it, and I think there is a unique space in the role of UNAIDS because we actually have civil society on our board. So different from many other UN spaces. And as we are thinking about how civil space or civic space is shrinking around the world, it is also shrinking in multilateral settings. So let's protect that space that we have in UNAIDS and make the best out of the fact that we do have civil society there. And UNAIDS very particularly wants to honor that this year, but our World AIDS Day theme and report will be about the role of communities. And we're collecting examples at the moment to hopefully find an interesting way to speak to that, because what we're doing at, even this panel, very quickly, we will be at the dark end of things about the things that are not working and where it is shrinking. But we also have examples where it has grown over time and where civil society has been able to play the role that they play so well in these particular roles. So is it shrinking? Yes, and it's shrinking all across. And I was speaking to Maxi earlier on and others. We tend to look at the places where it is shrinking the most. And we say, the Uganda example becomes shorthand for it is all in Africa. It is all over. It is in all other parts of the world. And we need to ask ourselves why that is and what we collectively can do about it. Yeah. So I could give many examples. I can speak a little bit more about Uganda later. But we also see it in Asia. We see even places where we have seen good laws develop and law and policy, monitoring laws and policies and asking for change. And maybe one little side note, when we are saying civil society is engaged in changing laws, that often happens by litigation. And we often forget to say that. So, and I say that with great respect for my other home country, Botswana, where we now have decriminalized homosexuality. And I was speaking there a couple of weeks ago, and I had to say to the permanent secretary, let's just be honest, you didn't decriminalize, you lost twice in court, which is also okay, right? That's how legal change happens. And that's okay. And she smiled and said, yeah, true. And maybe that's an easier way than to try and get a legal provision through parliament, which is really hard to do in many countries. Yeah. So the very important role that civil society has is to go to court, challenge laws, and create new laws. Mm-hmm. But let's look at other countries. Indonesia, out of a sudden, they criminalized last year, they criminalized extramarital sex. that has a huge impact on all sorts of sexual health provision and groups engaging in that space. Let's look at Eastern Europe and Central Asia, and I'm sure Andre will talk about it. Lots and lots of laws coming up that look very similar to laws in the Russian Federation around foreign agents. So it's about not accepting money from the outside, not being seen to be acting on behalf of a foreign power. These are ways of stifling civil society engagement. I probably have a lot more. Afghanistan, out of a sudden, half of the population is no longer allowed to participate in civic life, right? That's shrinking space. So there's many places where we should really be worried. There are many places where space has grown, and I think all of us sitting here, I'm a product of civil society, everybody else is, and we have grown and are being in spaces where we can speak on behalf, we can create space. But I think we need to be very careful that we're not losing what we have gained and really protect it and make sure we carry that protection into all those spaces.
So let's look at one region, Andri. Eastern Europe, Central Asia has seen the fastest growing HIV epidemic in the world, with an increase of nearly 50% of newly infected people since 2010. So how do you perceive the changes in the legal environment surrounding key populations, people living with HIV, and civil society in Europe, in Eastern Europe and Central Asia? What do you see as the drivers for shrinking space, if it is? And I'll ask you the same questions. Are there any positive signs of hope where you see countries, regions, or even small changes where you see civic space expanding or improving?
Yeah, thank you. Thank you for putting light on our region, Eastern Europe and Central Asia. But actually, it's a very diverse region. There is no single solid trend. There are rather two opposite trends, with some countries like Ukraine, Moldova, Georgia taking epidemic under control due to focusing work on key populations, due to substantial engagement of civil society. And some countries like Russia neglecting all the things evidence-based where epidemic is going up. So it's really two trends in the different directions. And well, in regard to the driving force, I also actually would like to highlight, it's not a natural shrinking. It's someone does bad things to shrink civil society space. So there is a force behind this. Yeah. And what we really observe in our region, even before brutal invasion to Ukraine from Russians, there was a kind of quasi-war in public health area and HIV in the region. I would describe it as a war between ideology, prejudice, stereotypes from one side, and evidence-based science from another side. So because in Russia, they not only within the country declined and neglected all evidence-based interventions like methadone-based opiate treatment or harm reduction program for people who use drugs, but also they imposing these standards to other countries, influencing other countries, like we observe in Kyrgyzstan. Law on foreign agent, which limits civil society operation, which already existed and has been existing in Russia for nearly 3 years, now put forward by parliament in Kyrgyzstan. Well, in Russia itself, definitely civil society is shrinking, and the recent development just in August, parliament voted for prohibition of transgender transition. So it's nonsense in our times to prohibit it. It's a brutal prohibition, but it was voted by the parliament unanimously. Could you imagine? So this is an example of really totalitarian state with the president of Russia signing. Well, on the positive side, for us in Ukraine, of course, war and sustaining services during the war became really a kind of crash test. We passed. And key services were picked up by civil society, and even beyond our regular scope. Like, this is an example how long-term investment in civil society actually is paying back in the time of the crisis. Well, one example is, again, delivery of medications, opioid agonist treatment, methadone. Logistic company hired by Ministry of Health declined to do this. They say, sorry, for our drivers, it's too much risk. Nobody asked what will be the risk for thousands of patients, for treatment interruption. So we stepped in and said, we can do this, we will do this. And we did this with delivery of OST medications. And this is an example like all other players say no, and civil society says yes. So it's really value added. So it's not something we should ask, something unnecessary, but really a key role civil society is playing in HIV response, especially in the time of the crisis.
And I wonder how that is in Eastern and Southern Africa, Maximina, where you're based. So obviously it's the region where much progress has been made, but it's still the most heavily impacted by the HIV pandemic, epidemic. So when you look across the region, and obviously it's not one monopolistic thing, it's like obviously diversity in the region, but so how do you perceive the changes in civic space for civil society organizations, particularly those working in service delivery for people living with HIV? And when you think of what sort of are the driving factors or forces, are there underlying socio-political, cultural, or perhaps religious factors that have contributed to arguably conservative or even restrictive policies in the area?
Thank you so much. So thank you to my previous speakers as well, because I think we're going to be speaking from the same sentiment as well. I think one thing that we can all agree is that in the last decade we have seen, progressive lawmaking in the sub-Saharan Africa in terms of how we can address different challenges that we are facing, right? The only challenge that we have is how we are implementing these laws, how are we implementing these different charters that we love to develop so much. And as a result of that, and in witnessing some of these, we are also even witnessing the momentum around the anti-rights movements where it's taking over. We're also starting to see the regression in terms of these laws, policies that have been beautifully put in place. For example, I know Chrissy also talked about Botswana, the ruling law, which is really brilliant, right? But recently we also saw actually our colleagues from the other side of the world, which is the religion side, marching in the streets, are pushing for and promoting, and in favor of the anti-rights movements as well. So what does it even say in terms of the legal environment that we're all operating in terms of the civic society? We're all trying to, bring about the Ugandan bill. We're loving talking about it, and one thing we can all agree is that it was a catalyst in terms of the hate that we're now starting to see, the criminalization that we're trying to see, especially across sub-Saharan Africa's countries as well. I think one thing I've realized is that it has increased what has been brewing, and happening underground, but really no one was paying attention to. I think all of us, we have shared different examples of what's happening, not only in Africa, but across different regions altogether. But really, we haven't been really paying attention to. We haven't been really having critical conversations in terms of how do we unpack it and how do we address that real issue, because this is where everything else emanates from, and this is where different barriers then comes in place when it comes to access to services, access to lifelong treatment, medication that we need. I remember for decades, our communities, our different, people in our diversities, we've been criminalized. We can talk about, young women selling sex. We can talk about people who use drugs within our communities. HIV criminalization, we have been having all of these issues, but we haven't been really paying attention to it. It's only that now that we're hearing these different aspects that when we say, we need to focus on certain countries or a certain region, but it's really happening across. I remember from myself, when I wanted to, I was pregnant, and I tend to then kind of debate with myself, right, to say, am I going to breastfeed my child because I'm living with HIV? What about HIV criminalization? What does it even mean? But I was researching, consulting at a point of privileged place. I was able to have access to information and able to defend myself. But what about the rest of the young mothers living with HIVs in our communities, where we are constantly being criminalized, where we are constantly not having access or even fear of doing what is fundamentally right? What is fundamentally right, even for my child, my babies, rights in order for me to breastfeed him or her. So all those issues, we have seen them happening. So in a sense, it then prevents people from accessing, like I mentioned, life-saving services due to the issues of safety. But even as civil societies, it makes it even harder for us to do the community outreach services that we have been doing so successfully. I think we've been hearing different examples of how civil society, the power that we will, the interventions that we've been implementing, leading, how it's saving lives, many lives that we're talking about. So it makes it even more dangerous, especially when we're having this, anti-rights movements, but also criminalization laws that are in place. So where is this all emanating from? We need to understand, like what you're saying, what are some of the social, cultural, contributors in terms of some of these issues that we're talking about. And one thing we can all agree is that many societies, especially in sub-Saharan Africa, is centrally embedded or rooted in the issues around cultural, around religious, around traditional norms, values. And we are not disputing that, right? It's fundamentally a right of everyone to believe in something, and it holds communities together. The values that we're talking about. It also have a sense of belonging, a sense of community. But on the downside of it, it only becomes more dangerous, it becomes more wrong when these practices are becoming a key driver in terms of doing harm, in terms of, violating the human rights. This is where the only downside of these values and cultures that have been in place. And we know that there is also that cohesion to align with conservative policies, particularly in the issues of around family structures, gender roles, and social norms. That's what we have seen happening, especially in the legal environment that we're operating. Religion, especially in our sub-Saharan Africa, has a really significant role in terms of how it influences policies. It matters who has the money. And unfortunately, our opposition have the money. They have the funding. So they are going in those different structures that are in place, influencing what is happening in politics, the leaders, and be able to influence even the laws that are in place that intends, at the end of the day, violating our rights as communities. So what exactly are we saying? The other components we have seen that it's also influencing, and also some countries in the region have witnessed the rise of anti-LGBTQI sentiments, often driven by the coercive, religious laws and beliefs. We know that, key populations have become, scapegoated. Laws and criminalization in our communities have been really enacted in some nations, contributing to polarization and public conservative policies.
And I'd like to pick up on what you're mentioning in terms of the implications of that, of the shrinking civic space, and even laws specifically targeting key populations and people living with HIV. And Andri, I'm wondering, in your region, or from your perspective, what do you see as the implications or the consequence of when civic space is shrinking and there are laws or policies that target certain people. And I think I read this statistic that said in Eastern Europe, Central Asia, HIV prevalence is estimated at only around 1% in the general population, but 7% among people who inject drugs. So that's 7 times that. So clearly, these policies are having an effect. So what do you see as the implications of that? And does that affect funding that is available to you also?
Yeah, absolutely. With punitive law and repressive policies, risk of HIV infection is increasing by times. Well, I mean, we have, even with UNAIDS, the data showing how vulnerable are people who use drugs, men having sex with men, sex workers, transgender people, in the situation of punitive law. So the risk increased from, I think, 7% to over 30% with the transgender people. So it's really has negative impact on HIV response. But also it's a violation of human rights. We shouldn't forget that it's not only medically driven argument, so it's fundamental human rights argument. So we should respect rights of people. Previously you asked to think positively, so I also would like to share one example we did within multi-country program, which covers 14 countries with the Global Fund support. We helped to establish a high-level drug policy commission. For example, for Eastern Europe and Central Asia, it's chaired by former president of Poland, Alexander Kwasniewski, who became really a supporter of harm reduction program and program for key populations. So he can open doors to decision makers. And it's very important because we as civil society, we're of course very active and shouting and criticizing, but sometimes you need a peer to talk with each other. And if president talks, for example, with president of Moldova or had a visit to Kazakhstan, it has positive impact. So I think it's very important for us to be successful, to make allies, to do partnership of community, civil society, policymakers, international institutions in order to change this negative trend we are facing.
So you're already leading the segue into what can be done about it. And this is, so both Maximina and Andri have spoken about the implications of the shrinking civic space, but you're leading us to what can be done about it. And so I want to discuss this briefly with the panel, and then we'll turn it over to you, so do get ready with your questions. Christine, thinking about what to do about the shrinking civic space and about enabling an effective HIV response. What can and what does UNAIDS do to support and advocate for community-led HIV response in countries where there is a shrinking civic space? And what should UNAIDS, but also other international organizations, focus on when thinking about either defending civic space or enabling and empowering positive developments that Andri and Maximina both just mentioned? Christine.
Yeah, I think many different things. Maybe let me start with Uganda, because that's part of how we started the conversation. One thing that we can do as the UN and as UNAIDS in particular, because we have a slightly different role. We are a joint program of 11 UN agencies. So one of the things we did in Uganda over quite a long period of time was to be the convener of civil society, of LGBTI groups, other groups that were feeling quite threatened, and provide space, safe space, which is something we shouldn't underestimate. When people feel under threat, you need a safe space to gather yourself, to think tactically, and so forth. But also to provide a safe space to meet with government. That's a role of the UN, a space where you can meet each other and talk to each other without feeling threatened by the government. That's very complicated to do, depending on what the space looks like. Now, because the law has gone through and it's now being challenged in the courts, there's another role we can play. We're about to file an amicus curiae as UNAIDS, as a friend to the court. And I always want to explain to people, we're not suing anybody, but what we're doing, and that's a really important role the UN can play, is we are offering additional information. So we're saying to the court, We get that you have to consider this. Let us help you to put all the information that you could possibly need to make the right decision. And part of that information is obviously around the impact, the public health impact that a law like this can create. So lots of very practical things we can do. I wanted to quickly just link to what Andrew was saying. I think this issue, and I totally agree, I come from human rights, and sometimes it feels weird that we're making public health arguments instead of saying every person counts. And we have a Universal Declaration of Human Rights that we have all signed as member states in the UN, and then we say, but actually you should protect human rights because it makes public health sense. So that doesn't always feel comfortable, but I think it's an important role to play. And so, for example, in Uganda, one of the things we did, and we called together PEPFAR, the Global Fund, and UNAIDS to make a statement to the government to say what you are doing undermines your public health efforts. And this is what will happen to your AIDS program. And it won't be about the LGBTI community necessarily, because it means communities altogether lose faith in the government. So that's an important role. I think we also, I don't know, lots of people in the room are people who are working on these issues. I think one of the things we need to think creatively together with is what can we do and what role can every one of us play to protect the spaces that we currently have? Because they are being under attack. And they're under attack not just for the LGBTI community or the drug user community. Women's rights are under attack at all sorts of levels, like we're going to CEDAW at the beginning of next year. We will have to fight very hard to protect what we gained. And one of the things we often can do that as the UN is to make sure that civil society sits at the table, that there are divergent voices and so forth. But what else can we do? Where are the spaces that we can protect? And as Andre says, sometimes prime ministers or former prime ministers open doors. Sometimes the UN can open doors. What are the people, what are the gatekeepers we can bring in to keep on trying to push back and open spaces? But I would love to hear from others in the room who are all, I can see a lot of people from civil society who all have ideas. From our perspective, we are very much protecting the space that we have on our board, which has civil society, and that's going to become more and more contested. But also how to use that space to have broader conversations around how important it is and how to learn from the AIDS response for new pandemics, for other development issues where we have shown the power of communities to drive development and to drive human rights for all.
And we'll get to the audience in just a second, but before we get there, Christine mentioned the divergent voices, as she said, which should be front and center. Peter, now, what is, from your perspective, you've been active in this space for so long, you're regularly participating as an observer in international fora on HIV/AIDS. What is or should be the role of international organizations and government in this space? But also, have you seen, are you aware of strategies that have been effective in countering discriminatory legislation where it occurs?
Well, I mean, of course, I have to highlight here the function and the work of UNAIDS, because what we see in that PCP meetings, and congratulations to our government. So I was nasty before, but now I'm friendly. That they really do whatever they can to sort of give civil society a space there, and we see how declarations do get watered down by a couple of governments. I come from civil society, I can name them, like Iran and Russia and all of those governments that really would sort of influence documents that they almost become meaningless. So we've seen it, the UN high-level meeting came up with a declaration, the UHC, that does not even mention the key populations and the groups that should be there because they are so important in the fight against HIV and other diseases like gay men, like drug users and all of those sex workers. They are not mentioned there. And they are not then mentioned there because some of the governments don't want these groups to exist, because some governments are there that want to even extinguish those groups, you see. So this is exactly what's going on at international level, and luckily we have organizations that work against that, and UNAIDS is one, and the Global Fund, and they come up with data in order to support, in order to explain what the impact of inequity is. And then we have other programs like the Global Fund that would come up with to design and develop programs based on the data they have from community and from the global from UNAIDS, in order to do something against it. So this is absolutely important. This needs to be defended. And let's make sure, I mean, I had so much glory was put over the WHO, and of course we need the WHO, but all these organizations, they were created outside WHO, because WHO seemed to be too weak and not strong enough, and too träge in Germany. What is that? Sleeping, whatever, in the sleeping modus, let's put it like that. So these organizations were created outside in order to change the situation, because the HIV response, when it started, it was something completely new, and the public thought, okay, WHO is not fit for purpose. So let's remind this as well. So we have to define the structures that we have. We need to finance the organizations that we have that work there, and this goes now to the financing of UNAIDS. So I would like to have our government to support UNAIDS in an appropriate way. So we asked for 20 million, and at the moment we are at 0.0. So this is simply not very helpful for civil society and for the space that this organization offers us, right? So let's discuss this as well.
Yep.
But now I think it's over to you.
Thank you. So if you heard Peter in the beginning, he was critical of the German government. Now he gave it praise. Now very critical of WHO. So hang in there. Later we'll get to the positives.
Blame and shame.
But
right?
before then, that's right. Andri, thinking about the relationship between international organizations and local organizations, and you very much work with the grassroots level as well, do you see ways in which local activists or organizations can collaborate with or tap into the power of international organizations such as UNAIDS, especially to address challenges that are posed by the shrinking civic space?
Yeah, absolutely. Well, UNAIDS is a key ally, also major donors, because sometimes funding is so critical. Funding channeled to civil society and community organizations. So that's why it's quite important to collaborate. For us, we facing the war with enormous range of emergent needs. Yeah, before we were focusing on key services for key populations. But if someone asks me for food, I cannot say, "Oh, sorry, I have only condom for you." Yeah, we need to be relevant in the context of humanitarian crisis. So to find for example, this kind of agility, flexibility, which we feel very strongly, is not often quickly supported by the donors and international organizations. So I'm actually very glad that the German government supported us, and we do mobile clinics now operating in liberated areas where hospitals are destroyed, there are no doctors, no pharmacies. So it's a good example of this emergency response. Or some things, well, we didn't run shelters before the war, but now it's so important to have even specialized, tailored, because in some bigger groups, people are so stigmatizing LGBTQI community, or people who use drugs, or people with TB, or already, well, with no danger for the environment, but just stigmatizing people who had TB. So that's why this is very important to find partners to do this. And well, talking about UN family, actually UNAIDS has a great bridges and outreach to other UN agencies. So it's very important ally to us in Ukraine and in the region as well, because there is a regional office.
And Maximina, before we turn to the audience, so thinking about other ways in which civic space could be protected or expanded, and before you already spoke about cultural, religious, societal influences, do you see potential for harnessing these perspectives to foster understanding, but also challenge the very much underlying assumptions of the anti-rights movement that you see or that you spoke about in some countries in Eastern and Southern Africa?
Thank you. So I'm going to start with what we've been talking about, which is really funding, right? I think one thing we can all agree is that it is unquestionable, the role, the power, and the will that communities do possess in terms of driving change. At the end of the day, we are not really, there's nothing that we can question about that, because we've got great examples that we have been sharing and that we've been really witnessing all along. What baffles me the most is that when it comes to investment, that's when we start to think about, why do we want to invest in civil society? Yet we are the drivers of change. Yet we are the ones that are even, doing most of the work on the ground. So what exactly are we saying? When you're talking about shrinking civic space, which is the space that us as communities are striving, this is the safe spaces that we have our conversations, that we come together and addresses many needs that we have as communities. So until we start to think about what is the intentional funding towards communities and how do we make sure that when the funding is available, all the red tapes, that comes with that funding is removed, I think we can never be flexible in terms of the services that our communities do receive at the end of the day. How do I, as a community, want to receive on the receiving end when the environment is not safe for me? And we know that civil society has been the one that is driving these safe spaces in terms of flexibility. I might not want to go to a facility because I know in the very same facility, that's where I'm being arrested at the end of the day. So how do I find services where it's safe for me? And it comes with this funding. So we need to invest in civil society. Full stop, there's no question about that. Then in terms of us improving some of these, anti-rights movements and how do we go about it? I think I love what Chrissy also said in the previous session that we're having, that we have allies in the faith-based organizations or faith-based communities, right? How are we also bringing them to the table to actually start to discuss some of these issues, to really have them also lead some of the advocacy around how we can change the perspective on the other counterparts is very important. But also we need to start thinking about how do we have real conversations, naming, identifying what are the issues. Sometimes I think in these spaces, to be honest, I'm not criticizing the agenda of World Health, Summit, but I think this is the only session where we talked about anti-rights movement. But it's a big issue. It's a big issue. So what are we saying? Because we are the communities that are affected, and yet we are promoting we need to have the communities at the center, we need to invest in communities. But at the end of the day, we don't want to talk about the real issues about, anti-rights movement, about racism, about colonialism, all of those issues, the real conversations. But also we need to move away from our comfortable spaces and really try to then say, okay, we have the counterparts, we've got the religious, we've got the culture, aspects of it that are promoting anti-rights movements. How do we have bi-directional conversations with them, even if we don't agree, by the way, but how do we start to bring them into the spaces, understand different perspectives, and have a way forward together? Probably in some way we might make headways. Let me stop here so that we can have conversation.
Christine, you want to comment on this?
I wanted to, and Maxi got there before me, but I said it in a previous panel, but I think there's something there that we all need to think about. We do like our echo chambers, all of us do like them. And I think there is time for all of us in multilateral agencies, but also in civil society to think, as the space is shrinking, where are our allies, our unusual allies? And one of them is the faith-based communities. There's a lot of potential there. Lots of faith-based communities are very progressive. They were part of the anti-colonial struggles. They have done all sorts of other things. So and they want to be part of it. Let's see them if they can be allies in the shrinking human rights space. But what are other partners that we haven't thought about? Are we building broader communities as we're also thinking of, as we're progressing towards 2030 and ending AIDS as a public health threat? Can we create broader movements with the women's rights movements? We're doing it partly with the LGBTI movement, but there's others where I think, and there is a role for the UN to keep on convening diverging voices, but also diverse communities. And I think because of how we have grown as the AIDS response, we have been a bit, we have had a bit of a special focus on our own space, and I think we need to also be critically looking at ourselves and say, is there other people out there that we should be working with and working with differently? Maybe why we're not attracting them is because we're working in a certain way, we're using a certain language and so forth. So in shrinking space, I think it's about moving outwards and finding new partners and unusual allies.
And maybe they are in the room. So let's see if they're here.
Nice.
So now is the time for you to join the conversation. I'm in awe at the breadth and depth of what has already been brought up. So now it's up to you. So we have a microphone in the room to go around. I would kindly ask you that if you have a question to the panel, please do raise your hand. Tell us who you are, your affiliation, who on the panel you're addressing the question to, and please, please do be concise. Any questions? I see two. We'll start here on my left. We'll start with the lady and then with the gentleman in red. Yeah.
Thank you very much. Indra from AIDS Healthcare Foundation. Maybe we could go back to something that was very briefly mentioned, losing faith and trust. And also COVID-19 lessons were that actually the community-based organizations were the ones that people trusted and actually not the recommendations of government, the same one for vaccinations, for example. So actually a question for everyone in the panel or the person who volunteers. We have a feeling that maybe some more formal cooperation channels or consultation channels should be established, and how we can keep the governments accountable that these recommendations from civil society are respected and implemented. So maybe next year we can speak about expanding the civil space for the society and not only raising the voice of civil society, but also listening to it.
Thank you very much. The gentleman in the red shirt, because right next to it, and then I'll turn it to you, and then we'll come back to the panel.
Thank you very much. My name is Joseph Baraza from Kenya, Nairobi. The organization I work with is LVCT Health in Kenya. I'm happy to be here, and I've sat through your discussions, and I'd like just to direct first from our gentleman who mentioned his 30 years experience and the civil society growth. I wanted to know, was there anything about persons with disability in the growth for civil society? I'd like to hear something about it.
Thank you very much. And could we please let the microphone wander to the lady in the middle of the aisle? Thank you very much. Right here.
Thank you very much for the very insightful sharing. My name is Juliana. I'm from International SOS. We work on many health system strengthening and global health security space with public and private sectors, but mostly with private sectors. So perhaps that could be an area to explore as a new alliance. I think in light of the shrinking civic space, I'd like to hear your thoughts around how do you advocate the prevention of HIV and also anti-stigmatism of people infected with HIV at the workplace. Thank you.
Thank you very much. Let's take a breather here, think about more questions while we turn it back to the panel. So we had one on the sort of the formal engagement channels. Maybe Christine, you want to take a crack at that. Then persons with disability, that was for Peter, as I understood. And then private sector engagement and avoiding or working against discrimination against people in the workplace. Maybe Maximina and Endri, you want to, if you feel inspired, speak to that. Christine, we'll start with you.
Yeah, can I just double check? Were you asking about WHS or generally? Yeah. Yeah, I do think, I mean, there are channels, right? And I represent one of those channels. And there are channels at country level. So I do think that is really where you can use, I would say, you use the UN. So I've spent 25 years of my life dealing with government and governments as a civil society person. But where do you find the space of if government doesn't want to meet with you? I think this is where we need to hold on to the multilateral space, because somebody needs to convene, somebody needs to open doors. And, you know, you need to hold us all accountable when that doesn't happen, because it doesn't happen everywhere, and often it doesn't happen because multilateral organizations have a very specific role in a particular country. Often they don't just look about health, right? They have development contracts, they're looking at working in tandem with government and often don't want to shake the boat. So that is when I was saying earlier on, it is really important that we do not shy away from holding each other accountable in a respectful way. Peter has just done that in front of his own government. But I think we need to continue doing that. And when there aren't any channels available, you must go and speak out to the UN or donors who often also, or member states, you know, embassies, for example, who are giving that at country level. But I really, coming from the UN, I think that is the space that is available for this formal engagement, but it's also a very, very contested space, and you all know that. And I think that is what worries me personally the most, that at this particular time, the UN is under huge attack, and you can have all sorts of criticisms about the UN. I share many of them, but there is a fundamental role that we need to protect, which is to be that conduit between different member states and different constituencies, and I think we need to figure out together how we protect that space.
How does one engage with UN organizations and UNAIDS? Do you have a suggestion box?
Yeah, UNAIDS I think is the easiest one where we are, because we have if we are in country, it is through a country office. At the global level, it is through our NGO delegation. And through the NGO delegation, several people from the NGO delegation are here. GMP Plus is one of them, the Global Network of People Living with HIV. I think that is a particularly easy one in terms of there is already a formal piece set up. Yes. But when we are not at country level, we are 11 co-sponsors, go through one of the co-sponsors. And I think, you know, the UN is represented at country level through the regional representative or the regional representative resident coordinator. You know, you need to make use of those channels and hold us accountable that they open those channels. The UN is not there just to work with governments, and that has to be very clear. They sometimes do, and that's when we need to hold each other accountable. But this is a fluid world. It's a virtual world. Mm. Everybody has their channels. So I would use them. And if they don't work, you should tell us.
Mm. Thank you. Fantastic. Peter.
Yeah, and UNAIDS is currently looking for one representative from Europe. So feel encouraged. You should be HIV positive. So make your test. And if you're lucky, you can apply. Okay, that was a joke. The question was disabilities. I mentioned when I talked about the different declarations or principles, I mentioned the CHIPA. No, nothing behind us without us as one of the principles that really dates back to the movement to the African disability movement, and this was taken on board by the HIV community, and is now one of the main claims that you hear all over the place. You know, I mean, the question is now, do that claims make difference? I would say yes, because the message is crystal clear. You don't you don't make decisions without asking us. So that's pretty straightforward. In terms of having affiliation, because we discussed the context, you know, how to find partners and all of that, I think we never really achieved a strong partnership between the HIV movement and the disability movement. And I talk now about the context here in Germany. So 15 years ago, I published a book on behalf of the Deutsche AIDS-Hilfe, the German AIDS Federation, where we looked into detail on possibilities to sort of bring both movements together. But my experience is that people living with HIV, they don't identify themselves as handicapped people. So this makes it quite difficult to bring both groups together.
Thank you, Peter. And Maximina and Andrei, maybe you want to speak on the issue of private sector engagement and HIV in the workplace, but also if any of the other questions struck a tone. Maximina.
Yes, so let me quickly address on formal engagement channels, because I think a lot of work that we've done in civil society is to really push have these different infrastructures, right, for us to hold, policymakers, implementers accountable, and we have established these very well. I think what we then need to do is then not lose those gains, but how do we strengthen those as a collective, not to create a whole other, new platforms or formal structures. We already have some of those. So I think let's relook at what we already have and create different loops in terms of how do we then connect different, levels of engagements, whether it's from the community, where the most left behind are linking to the national and also the global, whether it's PCB or any other platform that have been really created. And lastly, I'm just going to sound a little bit controversial, is that in our civic spaces as civil society, we also need to hold ourselves accountable amongst ourselves and interrogate and investigate amongst ourselves in terms of who is representing us, whose voices are we, promoting, and what are the issues are we pushing at the table, the privileges that we have, how are we also making sure that everyone is also being representative in there.
Andrei.
Yeah, I also would like to comment on several things. One is on civil society engagement. In Ukraine, we are addressing this proactively. So, of course, there is a parliamentary group. It's important for civil society to get involved, also to ensure transparency. Sometimes procurement groups discussing specifications, of medical procurement and medications to be there. And in some cases, it's not only kind of external observing mechanism, but also bringing value, like for some specific items like procuring syringes, Ministry of Health, for people who use drugs. But they have no idea what kind of needles it should be, and all these nuances can be provided and assessed by community experts. So it's different from a medical, injections in the bottom.
Yeah. Civil society can be a source of
expertise. Exactly. Right. Even internationally, because I've mentioned this regional project, so it's actually underestimated power of multi-country exchanges, because like with pre-exposure prophylaxis. So we were called by Moldova or Balkan countries, please come to us, please share your experience, how you started, how you engage civil society and community workers to make it running. So it is very, very important component also to offer something, not just to demand, but to offer. And this offer is, if it's not accepted, try again and again. So this is a recipe. Yeah, for handicapped people, unfortunately in Ukraine we have war, and more people, including from key populations, people living with HIV, also kind of suffering from injuries, traumas, and this is unfortunately emerging big issue. We are rather looking for expertise because we didn't face this before. With the workplace, who is the largest employer in Ukraine at the moment? Ministry of Defense. So it's a big issue. Well, it's a bit of taboo, but it's a very important issue, how we are addressing, testing, do diagnostics and provide support for, well, for service people in the army, because in TB, they are not, bullet vest doesn't protect from TB, yeah, or helmet. So, and with such condition, it's a growing issue. With such huge increase of blood-to-blood contact on the front line, again, it doesn't help to protect from HIV. So it's a kind of taboo, but for to be instrumental, to be proactive, it's very important to address this issue as well, not to neglect them. Like, oh, we are not military. Oh, sorry, no, it's not.
Yeah.
Maximino, you want to add something to that? And then
Yeah.
we'll take a brief last round, so get your questions ready if you have one.
Definitely, and I think it goes back to what we've been saying, right, is that we need to move outside our normalcy and look at what are the other key players that we can bring on board, especially when looking at HIV in workspace, because we know at large this is where our rights have been violated a lot. I remember when I wanted to apply for a certain college in another country, I was denied solely because I was living with HIV. So how do we bring those, that are not usual players, like the Minister of Defense, like what we've been highlighting, how do we start the conversations with them and for them to really understand what is our rights and what do we, are supposed to be practiced when it comes to HIV in the workspace. I suppose it's very important, but also the laws as well also failed us in that aspect. How do we also look at different policies that are in place in order for us to revise all those components, but also bringing other players like international players that are looking at the issues of labor. How do we make sure that there are laws and policies that protect us, especially us living with HIV? It's really important. Yeah.
Thank you. Are there any more questions? I see 1, 2. That's a great start. So let's start over here.
Hi, everyone. Stefan Anderson, Health Policy Watch. So I want to pick up on a point that Maximina made about the need for financial investment in civil society. Peter spoke about, gave a historical example of the importance of civil society in the HIV epidemic. A very recent example is Andriy and everyone in Ukraine who are literally riding bicycles to go set up clinics on the front lines. So I guess my question is, why does civil society have to keep justifying the need for investment? It seems like they've proved themselves over and over and over. And so why is it so hard to make that argument inside the prevailing power structures? Is that just how the world works, and what can we do about it?
The short answer is it might be, but let's get to that, unfortunately. The other question was on the other. Could you raise your hand again, please? It's the gentleman in the white shirt in the middle.
I would like to answer.
Hello, my name is Hilal Qasim. I'm a social psychologist and a former researcher in the stigma of infectious diseases. My question is about the psychosocial aspects of maybe expanding the civic space. Would the Ministry of Health consider working in depth with the Ministry of Education, and will we one day maybe see the HIV topic compulsory in the education curricula in high schools, and not just the medical aspect of it, but the psychological and the social aspect, and how stigma, because we know from research that stigma is correlated with the expansion of any disease. It's all in research. So my question is about the collaboration between the ministries to achieve this goal.
Recognizing we don't have them on the panel, but we can have our panelists reflect on whether that's a great idea. Do we have one more question? Okay, there's here the lady in the gray jacket, and that'll be it.
Yeah, thank you very much, and thank you for excellent panelists. I really enjoy the conversation. My name is Oanh, and I'm from Vietnam, and I understand very well when people talk about shrinking civic space. One of my recommendation, my observation and recommendation, and from my experience, is that when there's a shrinking civic space happen, it is really the investment in civil society and community needed even more than if not the case. Because we need to exist. We need to be able to exist. We need to be able to capacitate it. We need to survive in order to thrive in a better environment. But oftentimes, donor, when it happens, donor would run away because donor doesn't want to go into conflict with the government. Donor doesn't want to look contradictory, controversial, etc. So I am wondering, and since this session is hosted by German Ministry of Health, I would like to hear from the Ministry of Health of Germany in particular, and of course here you have any other people can comment on that. What did you do as a government, as a donor, when it happened, when your investment may not be welcomed by such and such government? Thank you.
And luckily we'll have Paul Zubal of the German government close the session, so perhaps he'll want to comment on that. But so we have 3 fantastic interventions or questions about civil society still having to justify its activity or not, about sort of Ministry of Health, Ministry of Education, agreeing, working together on curricula and other things, which seems commonsensical, but maybe it is not. So I'd be curious for your reflections, and then investments in civil society when a government does that, but it might not be welcomed by another government, which you might or might not have experienced as well. So I would like to ask you, so if perhaps we just let everyone sort of have a stab at these really excellent interventions and round off your response with a 1 sentence or 1 minute maximum closing reflection or key message that you want to give into people's ears as they're leaving this session, both in the room and online. I'll start this time on the far end. Andri.
Okay. Yeah, this is a very good question, because civil society, it's proven that it's deliver better than the governmental agency, like Global Fund did assessment. So in terms of delivering results, making impact, it's better. In terms of sustainability, it's also a myth that investing in ministries and ministers is a sustainable investment. So I worked with over 15, and I even don't remember someone's name. So at the time, so civil society remains there, communities remain there. So it's very sustainable investment, and I think it should be appreciated by donors as well. So it's yeah. So I hope it will be the case. So in regard to question of with Ministry of Education collaboration, we do. But again, this is very sensitive area in terms of shrinking civil society space, because what happened in Kyrgyzstan, they approved the law on protecting children from sexual propaganda, etc. And well, intention is good, but any material for LGBTQI information material now might be seen as a promotion of pornography which children might see. So this is a very good question, and we should also work on this, because the shrinking of space touches sphere of education as well. I'm not mentioning testing, for example, also very restricted. Go with your parents. We cannot give you a test, for 16 years old, for example, which is nonsense. So, and in terms of the message, my message is I'm from Ukraine. So we are resilient, we are strong, and wish everybody to be strong, to bring partnership together, and together we will win this fight and many fights.
Thank you, Anthony. Maximina.
Okay, thank you so much. So you and I think most of us are in the same boat, right? That's the big question, $1 million question as well. And I think I would really love to hear from the funders in the room how they're going to respond to that. But one thing I've also realized is that there's also a point of where, funders, then tend to take advantage, because when we say, communities, we are resilient, we are working from a position of passion and our willpower, because these are the issues that affect us at the end of the day. So they expect us to then be volunteers in terms of implementing these activities, right? So in that just aspect alone, it questions a lot in terms of, this funding and why civil society should then have funding. So we need to interrogate all of that, but I would really love to hear from the funders in the room at the end of the day. Then another aspect around the Ministry of Education, I think we have a whole curricula that we have around comprehensive sexual education that we've been really promoting, that we've been pushing, especially from the civil society aspect, right? And we've got different agencies, even here, UNAIDS is also pushing together with us in terms of comprehensive sexuality education, which is mostly should be sitting under Ministry of Education. What we've been seeing is the pushback, and it also goes back to the key aspect that we've been talking about, issues around, gender inequalities, but also social and cultural harms and practices that are in place that doesn't allow us to actually even name the issue of sex. I was in Zambia some time ago, and they said, because it is just saying sexuality, they're thinking it's sex, and whereas it's not, it's a whole lot of, components that we need to expand and understand. So we have different components about how do we then ensure that we are implementing it, and we are linking all this between Ministry of Health and Ministry of Education, so it's really important. Yeah, I'll end of that.
Do you want to give us a one sentence kind of, your word of hope or a closing reflection? Be mindful of time also.
Yes. Just I think like what I said before is that, as civil societies, we have a critical role. We have the willpower, we have, the technicalities, the expertise for us to make change within our societies. So there shouldn't be any question in terms of investments, but also working together with us, bringing us to the table, and also being able to collaborate with us at the end of the day. What I would really love to leave everyone here, especially to the technocrats that are in the room, is that, don't come into our communities most of the times to diagnose us. Come with solutions. I think it's a high time we move away from hearing these statistics, challenges, Uganda bill and what is caused, and you go back and you write your beautiful stories or beautiful papers, you publish them, but at the end of the day, we don't have solutions on the ground. These are our lived lives. These are our realities at the end of the day. So what are you doing in your own right, in your own privilege, in terms of really pushing for the communities and our well-being? And in all of that, I think we will then be able to end AIDS by 2030. Thank you.
Thank you. Christina and Peter, we have about a minute each, so if you want to both answer the questions and give a closing reflection, that would be much appreciated.
I actually wanted to say something about the funding, because I think there is something that we haven't spoken about here. So we're thinking about moving from an emergency response in HIV to a sustained response. We want our governments every government to pay for their own response, and that includes social contracting. It's a very big aim that we all have, and we see in countries where there is an increasing social contracting of civil society, which in theory is exactly what we all want. It doesn't need to be an outside government when the time and the space is right to come in. But what we're also seeing is that it disempowers civil society very often. So the voice gets lower, the monitoring and holding accountable gets lower. And so there is something there that we need to get right as we're walking into a sustained response that makes sure that when civil society is socially contracted through their own national government, how do we protect that space to still be a critical friend to government, to monitor and to speak up for those communities that otherwise won't get hurt. We haven't talked about that at all here. It's not just all about the money that is coming from outside. How are we making sure the money is within the countries is right? I don't have one sentence, or maybe two sentences. One is, let's all be very clear that the threat is very real, and it's very real at very different levels. And let's not sit here in 5 years' time and say, we didn't know, we didn't pay attention. Those of us who could have done something didn't do anything. It is real at the multilateral level, and it's real at national level. So let's be very conscious about that. And because I am a hopeful and optimistic person, let's build on the amazing gains that we have had in the AIDS response. There isn't another space where we have built such strong community engagement in systems. Let's build on that for reaching all the SDGs and using what we have for other movements, because we have done a great job in so many ways, and build on that, and let's not lose hope that we can't move on from here.
Peter, your
Yes.
1 minute.
I think I would like to start to stop with something positive. The fact that the new infection rates in Germany are so low and that we have one of the best responses in Europe in terms of infections just sort of proves that our government throughout the last 20, 30 years did do the right thing to integrate and to finance community responses. So a huge thanks for that and a huge congratulations. The fact that we have here a panel on that particular topic, and then the fact that I can criticize my government, I think speaks for itself. So there's an openness. Then even if there are critical issues, I think there is, and this is exactly what I experienced in different forums, there's an openness to listen to the voices of civil society and to bring them on the board. Nevertheless, we've seen flaws, and I criticized that there was no UN high-level meeting. So my last minute of hope is there's a UN high-level meeting next year on UHC, and I really ask you as the Ministry of Health to establish and to put a delegation together where civil society is on board, to come up with a selection procedure that is transparent, and to have us there, because we have something to say there. AMR is a really critical topic for many of our organizations, so we want to be there and we want to raise our voice, and you have the power to guarantee that. Thank you.
Thank you, Peter. Now, I would like to invite, for the closing, Paul Zubal from the Federal Ministry of Health to the podium for his closing reflections. And while he comes up, please give a huge round of applause to our panelists.
Thank you very much for a very compelling discussion on a fantastic panel. I have the speaking points here, but I don't want to read them because I want to talk about something else. What really struck me was really the amazing ideas that everyone put forward. I heard, for instance, Maxima talking about we are the creators of change. I heard Christine talking about we need to have creative ideas. We need to find new allies. I heard Peter and Andrew talking and alluding to the human rights aspect. So what I'm trying to say is defending the civic space cannot be, by no means, and never be a pure spectator's game. We better figure it out how we can support this. And each and every one of us has a different role, a different perspective on it. From the government side, we can support by, for instance, having regular exchanges with non-state actors that we do on a very regular basis. We support it politically, but also financially. Multilateral, international organizations come with a different portfolio, different perspective, and so do the NGOs. So what I'm trying to say, the point I'm trying to make is we can only make it all together, so we cannot do it by ourselves. This brings me to really thank a fantastic panel. I'm leaving inspired. I hope so. I hope you do so too. And thank our fantastic moderator, Clemens, for facilitating today's session. Thank you very much.